Hello, everybody. I don't see anybody, but I gather that people are streaming in, so we're going to get started. A very warm welcome today to our briefing on the detention of Dr. Hussam Abu Safiya and other healthcare workers, as well as attacks on healthcare in Gaza. I'm Joseph Beliveau. I'm the Executive Director of MedGlobal, and I'm joined today by three panelists. Dr. Zaher Sahloul, who is president and co-founder of MedGlobal. Naji Abbas, who is the director of prisoners and detainees with Physicians for Human Rights, Israel. And Dr. Syed Sayeed, who is a plastic surgeon and a volunteer who has been on multiple medical missions to Gaza, including with MedGlobal, and very recently was at Al-Ali Hospital in southern Gaza. So the format for our gathering today, we have about 1 hour together, but it's not a hard stop. So hopefully we'll be able to have some Q&A and hopefully we'll be able to field all of the questions that you have. Apologies in advance if we're not able to get to all of the questions. For questions, there is a Q&A button. You should find that Q&A button at the bottom of your screen. Please put your questions, log those questions there. And then, as I said, we'll do our best to respond to those questions. After I say a few words, each of our panelists will speak for a few minutes as well, perhaps around 7-8 minutes each, and then we'll open it up to the Q&A. So a brief overview from my side. MedGlobal is a medical humanitarian organization dedicated to the principles of humanity, impartiality, and neutrality. This essentially means that MedGlobal provides medical care to the people who need it most, no matter who they are or where they are, in situations of armed conflict and without taking sides. MedGlobal has been in Gaza since 2019 and rapidly scaled up programs after October 2023. Since that time, 2 of our MedGlobal colleagues have been killed in Gaza, and 7 of our colleagues have been detained, 6 of whom remain arbitrarily arrested with no formal charges laid, no evidence of any crimes that we're aware of, nor do we have any information on their whereabouts, or very little information about their whereabouts or the conditions under which they are being detained. Most of our colleagues were detained at Kamal Adwan Hospital on October 26th. However, on December 27th, just a couple of weeks ago, Dr. Hussam Abu Safiya was detained from that facility. Based on eyewitness accounts, we believe he was taken to Taiman prison. However, today we can't confirm exactly where he is. That same day, December 27th, Kamal Adwan Hospital was shut down. And as of now, as of today, no further medical activities are rendered in that hospital, meaning that essentially the entire population of northern Gaza no longer has access to any secondary hospital-level healthcare. Here's some things that we do know about Dr. Hussam Abu Safiya. We know that he was an incredibly competent doctor. We know that he ran that hospital under conditions, the most severest, harshest conditions probably that any of us could imagine. We know that he knew the risks that he was taking every single day when he walked through the streets to get to that hospital and provide medical care to the people in that hospital. And he took those risks anyway. He is an extraordinary humanitarian. And in his own words, Dr. Abu Safiya was sharing with MedGlobal almost on a daily basis and certainly very frequently in the weeks leading up to December 27th. And so a few of his own words. On December 21st, the hospital walls are riddled with bullets and shells, making it resemble a military target. It is, in fact, a small and simple hospital that provides humanitarian services. On December 23rd, yesterday, all of a sudden, tanks and bulldozers approached the western gate of Kamal Adwan Hospital under heavy gunfire directed at the hospital and its departments. This is an extremely horrifying situation. The world must understand that our hospital is being targeted with the intent to kill and forcibly displace us. December 24th, yesterday, for the first time, robots advanced near the hospital. They were very close and they detonated explosives. The quadcopters dropping the bombs are targeting anyone who moves. December 26th, the night before he was detained. Unfortunately, last night was worse than the night before. Around 4:30 a.m., the blast was so powerful that it destroyed nearly everything: doors, windows, internal barriers, and glass inside the hospital, rendering the intensive care department almost non-functional. Shrapnel from one of these blasts penetrated the building and struck one of the patient's rooms, injuring a nurse. He suffers a severe head injury with his skull shattered and fractures to his face and jaw. Looking at the context more broadly, the Ministry of Health has reported over 500 medical workers have been killed in Gaza since October 2023. The United Nations has reported at least 136 separate strikes on 39 different medical facilities in Gaza. Since October of 2024, over the last 3 months, the World Health Organization verified at least 50 attacks on or near Kamal Adwan Hospital. So however you look at this situation, whatever examples you want to use, what we have seen is a pattern of blatant disregard for the fundamental principles of international humanitarian law, which protect civilians and explicitly protect medical spaces in situations of armed conflict. What we have been witnessing over the past 14 months, right up till today, is brutal and it is illegal. With that, I'm going to hand it over to my colleague, Dr. Zaher Sahloul, for a few words from his side.
Good morning. Happy New Year, everyone. And it's unfortunate that we start this year with this kind of panel discussion on yet another attacks on healthcare. And this, for me, as a humanitarian physician who practiced and had more than 50 medical missions in countries like Syria and Ukraine and Lebanon and Yemen and other places, this is a pattern that we have seen over and over, that civilians and civilian infrastructure and hospitals and ambulances and clinics and doctors and nurses are attacked during a war. The World Health Organization have been tracking these attacks on healthcare all over the world, and there is really very concerning pattern from Ukraine to Syria before the recent changes, to Gaza, to Ethiopia, to other places, Sudan. And this is one of them, Gaza. I mean, as my colleague Joe mentioned, some of the estimates of attacks on healthcare, more than 3 on average every day since the war started. More than 3 healthcare workers and humanitarian were killed every day since the war started. Kamal Adwan Hospital was attacked more than 50 times. And I think it's important to understand the impact of these attacks, because sometimes we look at it as a news from here and there. Kamal Adwan was attacked, Al-Shifa Hospital was attacked, and so forth. So right now in Gaza, there is only 7 hospitals out of the 39 hospitals that were functioning before the war that are functioning either completely or partially. 7 out of 39. That means 5 out of 6 hospitals in Gaza are not functioning. So about 85% of the hospitals in Gaza are not functioning anymore, which means that we are depriving the communities around these hospitals from access to healthcare. And we believe, all of us, that healthcare is a human right. So when you are removing a hospital or a clinic or killing a doctor or detaining nurses and physicians and administrators, that means you are forcing the community to leave. And this is what's happening in Gaza. Of course, all of us are familiar with the displacement in Gaza. More than 90% of the population are displaced. In Syria, originally from Syria, the impact of attacks on hospital created global refugee crisis. The fact that 650 hospitals in Syria were attacked by, at that time, the Assad regime and Russia, and more than 950 doctors and nurses in Syria were killed, created a refugee crisis that led to 7 million refugees all over the world. Still, one out of four refugees in the world is from Syria. We're seeing the same thing right now in Gaza. We're seeing attacks on healthcare that are frequent and systematic, that are preventing access of the communities to healthcare. When we talk about Al Shifa Hospital, for example, it went through the same pattern. Al Shifa Hospital was established in 1947. It is a tertiary center that serves about 750,000 patients every year. 750,000 patients every year. More than 70,000 surgeries are done in Al Shifa Hospital. Before it was attacked, the same accusations that it's a center of Hamas, tunnels, and all of these things. And then the hospital is not functioning. And when you remove a tertiary center, you cannot replace it by few field clinics here and there. That means patients who will need complicated surgeries will not have surgeries. Patients on dialysis will not get dialysis. Children who will need proper care will not get proper care. Pregnant women will not get prenatal care. And that will create untold morbidities and suffering and death that are not counted as victims of war. These are deaths related to the war, but it's related to removing this healthcare centers and anchors to the community. Kamal Adwan Hospital, I visited myself and I met with Dr. Abu Safiya in 2019. Small, humble hospital in Beit Lahia, in northern Gaza. In north of Gaza, you have three districts, Beit Lahia, Jabalia, and Beit Hanun. And there are three hospitals, Al-Auda Indonesian Hospital and Kamal Adwan Hospital. Kamal Adwan Hospital used to be a pediatric hospital. Dr. Hussam Abu Safiya is pediatrician. He actually went to Kazakhstan where he finished his training as a pediatrician. He came back to Gaza. He has dual citizenship. He married to his wife from Kazakhstan. He had 6 children. One of them is killed, as Joe mentioned, a couple of months ago when he was leaving the hospital. He was 19 years old, Ibrahim. He's himself injured. He had the option to leave Gaza before the crisis, as many physicians choose to do so because of the crisis, because of the multiple wars, because of the siege, but he chose to serve his community and build a hospital from scratch. Was very small, humble, was attacked multiple times, and despite of the limitation and the siege and the attacks, he was able to expand it to have about 180 or 200 beds in the war. He expanded the facilities and the operations to have operating rooms for the injured, dialysis for the patients who have kidney failure, emergency room, which was not there before the crisis, before this war. So despite of the war and the challenges and the attacks, he expanded the hospital facility. His main concern when I was communicating with him on a weekly basis, can we get electricity or diesel fuel for the generator? So the incubators for the neonatals and ventilators for the patients, the children in the intensive care unit don't die. Unfortunately, several of his patients died because of lack of electricity. Can we get medications for my patients in chronic diseases? Can we make sure that we have food for the medical team and for the patients? Can we make sure that we have this new incubator because our incubators were destroyed? And he became the face of the Palestinian healthcare workers over the year. We know numbers. I think numbers are important, but it's important to put face on the number. And he became the face of doctors under stress, of doctors under attack, of humanitarians who care about their patients, about their community, who continue to want to serve their communities despite of the attacks. And he had the option to leave to southern Gaza, but he did not do that. He wanted to serve his community. The 275,000 people who lived in northern Gaza are now less than 50,000 people. The three functioning hospitals in the beginning of the crisis, and there are small other hospitals, are not functioning anymore. Kamal Adwan is not functioning completely now, empty from patients and medical staff. It's destroyed partially. I mean, why would the Israeli army destroy a radiology department or ICU or operating room? Why do they attack not only the some hospital building or detain physicians, but they close the hospital completely. This is against any norm that we are familiar with, against international humanitarian law, and it should stop because it's depriving the communities and actually forcing the community to leave. Al-Auda and Indonesian hospital also are semi-closed right now. So the whole community is deprived from healthcare in northern Gaza, and that's leading to displacement. I just spoke with his family this morning. And unfortunately, besides the suffering that he has, they don't know, first of all, where is he, what happened to him. They hear news that he was taken to prison in Naqab desert. His lawyer tried to visit him, but he was denied the visitation. They did not get any information from him or messages from him, and they were very, very worried about his plight. They had some information from people who saw him that he bears marks of torture from some of the prisoners that were released from the same prison, but these are not confirmed. Unfortunately, his mother died this morning because of severe sadness. I spoke with her grandson, his son, Ilyas, and he told me she was crying last night and she felt that her son is in distress, and she went to sleep and she did not wake up. And she had no cardiac issues, no medical conditions before. She was very functioning. She died out of shock and sadness for what happened to her son. So that's the situation that we know. We, of course, as a physician, as a humanitarian, as the president of MedGlobal, as someone who has witnessed the impact of these wars on population from Syria to Ukraine to Bangladesh to Yemen to Colombia to our country here during the COVID pandemic, when we had dealt with stress similar to this, I believe that attacks on healthcare is immoral. It's depriving the communities from health, which is a human right. Attacking doctors and nurses is against medical neutrality and impartiality, and it should stop. And Dr. Hussam Abu Safiya should be released, and we are calling for his release. Thank you.
Thank you, Dr. Sahloul. Naji Abbas, can you join in with a few words?
Good evening, everybody. I'm already. I'm Naji. I will start with an introduction. Who's BHR? BHRI is one of the largest, if not the largest, human rights organization who operate inside the Green Line, inside the official border of Israel. We work in different fields. We work to provide and to protect the right of health for every individual between the river and the sea. We work with African refugees inside the border of Israel. We have a mobile clinic that works in the West Bank and in Gaza before the war. And we have other departments. And we work also on the right of health for prisoners and detainees, and actually for all the people who are under the custody of the Israeli authorities, mainly on the facilities which under the control of the IPS, the Israeli Prison Service. But since the start of the war in Gaza last year, we also work in the facilities and visit in the facilities that are being controlled by the Israeli army itself directly. That's a new thing for us. But because we try to protect and to advocate the right of health for all the detainees, we visit also in the prisons and also in the military camps that became detention facilities in the last year. In the last year, we visited hundreds of Palestinians under the Israeli custody. We submitted hundreds of letters and requests regard medical neglect and denying medical care. That's our main work. And we led and participated in a few petitions to the High Court in Israel, trying to provide and protect the rights of Palestinians under the custody. And in the last year, we are not working just on the right of health. We are working in everything, because in the last year, every right, a very basic human rights that you can think about, are being violated by the Israeli the detention system. Every right of a Palestinian, from health treatment, proper food, visits, the access of the ICRC to the detention facilities, hygiene, everything that you can think about, what the Israeli authorities and the Israeli detention system did in the last year, they actually stopped every sign of life in the detention facilities, every sign that you can think about. Even changing clothes, even in January, that are coming to the visits with short clothes. So we are working on everything actually regard detention, because all of these conditions, horrible conditions, affect health directly. And we led a few petitions like the trying to make the Israeli authorities give the ICRC access to the detention facilities, because for a year now they are denying them. That's a direct violation of the international law. We led a petition actually because in the last 6 months there was a pandemic of scabies between Palestinian prisoners, and all of them were denied from medical care. All of them were denied from being held in proper conditions or changing their clothes. BCHR was the main organization that led the revealing regards Detainees. Detainees is a military camp that started to be used as a detention facility. And actually we managed to reveal the horrific conditions, the deaths. Dozens of people died in this facility. And we managed to reveal what we call the Israeli Guantanamo. But unfortunately, with all this revealing and with all this work, we are not managing to change the big picture, because we usually, before the war, BCHR use the legal field and the legal work much. But after October the 7th, it seems that all our tools, our legal tools, our advocacy tools inside Israel, our lobbying work, all of that was vanished. Nothing is changing anything in regard the rights of Palestinian detainees. That's why we do more international work. That's why we do more media work, because we found out and we realized very fast that the only way to put pressure on the Israeli authorities to try and change even a little bit the conditions, the horrific conditions that Palestinians are facing in the detention facilities, is through international pressure and through media work. That's why we published a report already in February that we called it systematic violation of human rights, because already in February last year, after 3 months of the start of the war, we documented hundreds of testimonies of detainees that we visited, or detainees who was released, that showed that their rights were violated systematically. The violence, the torture, the medical neglect, and actually the denying of any medical care, denying any proper food, the denying of the access of the ICRC or the family visits. All of that was systematically and actually was part of an official policy. It's not a case here or case there. It's an official policy. And actually, that's what we found out after that regard medical personnel and healthcare workers in Gaza. Because if you follow the media, you can see in the first 6 months, the Israeli army said all the time, we arrested 300 terrorists, 500 terrorists, 1,000 terrorists. It was weird for us. And after that, and we didn't know anything regarding these people because the official policy of the Israeli army, it was what we, because for months we couldn't know anything about anyone from the detainees from Gaza, anything, or where are they, what their faith, are they alive or not? Till May, 7 months from the start of the war, we didn't know anything about any of the detainees. But we started to know that people in their 80s, a woman in her 80s with Alzheimer was arrested and kept in detention for 2 months. Medical workers, surgeons, doctors, nurses, everybody is getting arrested. And just in June and July, we started to visit some of the detainees, and we visited already 26 healthcare workers in the detention, some of them for a year now, some of them for 6 months. And we started to document what happened and what they faced, these medical doctor. And after that, now, and we are our plan is to publish this report, and we are already working to advocate actually internationally, because under the umbrella, let's call it, of the Israeli legal system, it seems that we have nothing to do, because nothing it can be done, because when we tried and went to the Israeli High Court, nothing changed. I can give you an example: the access of the access of the ICRC to the detention facilities. We submitted a petition in March last year. The Israeli authority asked 16 delays from the High Court, and yeah.
Sorry to interrupt, Naji. Can one more minute? Can you bring it to a close, and then
Okay,
so we have time for Q&A?
Yeah. So the court accepted the delays. That show you what the legal system in Israel can provide this now. In the last 2 weeks, we are working about the arrest of Dr. Abu Safiya. It was bizarre, actually, because in the beginning, in the first 3 days, when the whole world saw the arrest of Dr. Abu Safiya, the Israeli army said that they have no clue where he is, or that he is not in detention. After we revealed this bizarre response, they said that he is with the Israeli authorities, but he is abandoned from meeting a lawyer. What being with the Israeli authorities mean? It means nothing for us. They refuse to say where he is actually. We don't know in which facility. We don't know if he's safe or not. He is not allowed to meet a doctor yet. We don't know what he's being charged. We assume that they don't have anything against him, because from the 26 testimonies that we collected from healthcare workers, most of them were told directly that they are not accused or charged with anything, but they will stay in detention. That's illegal. That's is a legal detention. It's an illegal arrest, first of all. It's an illegal detention, and they are keeping and holding these healthcare workers, beside all of the 1,000 detainees from Gaza, from the West Bank, every Palestinian detention. The Israeli authorities are holding them in a horrific conditions that violate every international law, every law that you can think about.
Naji, thank you so much for that really detailed and insightful overview. It's super helpful. Dr. Sayeed, good to see you again. You could maybe share a few words from your recent experiences. And there's one question, Dr. Sayeed, in the Q&A so far that perhaps you could keep in mind. When you say 7 hospitals are partially functioning, can you please clarify what exactly that means? So maybe just as you're describing some of the working conditions you experience, what does that mean, partially function?
Sure. Thank you, Joseph, Naji, Dr. Sahloul. Thank you, MedGlobal, for this opportunity and shedding light on what's going on. So I've had the unique opportunity since April to travel to 4 different locations, twice in Gaza, once in the south and once in the north. With MedGlobal, I also traveled to Idlib, Syria, and I also traveled to the West Bank and performed surgery in the West Bank in November. So each of these situations, West Bank, Syria, and Gaza, are unique in their humanitarian crises. And I'm going to share with you what really stands out to me when it comes to Gaza and how this is a critical situation. But I first want to describe my most recent experience, which I just returned from on Friday, which was spending a little over 10 days at the Ahli Baptist Hospital, which is in north of the dividing line of Gaza, so in Gaza City. This is a hospital that was established many, many years ago by a faith-based initiative. It has roots in the Christian community. There's a church on the campus. There's a library on the campus. So I'll just describe the campus quickly as you walk through. When you walk through the campus and enter the gates, on the right side, there's a building that was funded by USAID and the Americans, which was the Radiology and Imaging Center, which was meant to become a cancer center. It's about 6 floors, blue windows, which are all blown out from the blast in the Ahli campus courtyard earlier on in the crisis. The first floor of that building houses the only CT scanner north of the dividing line in Gaza. The rest of the floors are unoccupied. You can see the curtains billowing in the wind. As you proceed in the campus, you see the building which houses the operating rooms on the first floor, and where international humanitarian workers reside when they're on the campus. There's a small library which is converted into a ward for patients. All the books are gone. There are curtains hanging up in between beds. There are flies flying around the patients and around the nursing station. The church on the campus has been converted into an internal medicine ward, where there are curtains dividing the patients in this ward also. Again, you see flies. You see an obvious lack of resources when it comes to medical equipment and medical supplies. And when you go into the emergency room, a severely constricted space with beds on top of each other with very little room to move between beds. Chronically filled with patients from attacks. I was in the building with the operating room on the first floor. There are 3 operating rooms there. This is a very small hospital. So there are 3 operating rooms and a 4th room where we perform dressing changes on patients with wound sepsis and considered contaminated or grossly contaminated cases. However, almost every single case in Gaza and the patients who are involved in blast injuries are contaminated, as the explosions really make all the particles and the environment around that individual airborne and go into the wounds, which has led to multi-drug resistant infections and wounds that are very hard to heal. Where a wound like that in the United States, we would have an easy time treating it with antibiotics. Almost every single case we do in Gaza becomes infected, and patients also sometimes don't even get to the hospital within a timely manner, and they sit in the areas where they were bombarded or attacked with festering wounds. While I was at the Ahli campus, the situation was a little different there than when I was in the south. The bombardment was constant. The sonic warfare that was going on was constant. The sounds of the drone low throughout the night. The sonic booms of the jets and the jets flying very low was obvious. I sent family and friends a recording, spent 2 minutes with me in Gaza, and all you could hear was the weaponry going off, the machine gun fire, the tank fire, as well as the bombs falling and the drones. While I was there also, the building right next door to our building was a subject of a tank attack where a missile or a projectile hit the top floor of the hospital along the roof line right underneath the solar panels. So I say solar panels, and the question was, can you describe what a partially functioning hospital is? So take, for example, to really understand this, a hospital, say in the United States, I'm in New York, what does it take for a hospital to work? You need physical infrastructure, you need electricity, you need sewage, you need plumbing, you need water, you need patients to come in, you need physicians to come in. So when you have a systemic and systematic destruction of all of these aspects of healthcare, you can imagine what a partially functioning hospital is. There's no confined rooms where patients can be treated. The antisepsis measures that we can take are extremely limited. Antibiotics are limited, dressings are limited, to the point where sometimes I would examine patients with one glove because there was a limitation on glove. And then how does the situation differ in Gaza compared to these other locations where I was in the last few months? Now imagine yourself in a box. All four corners of that box are surrounded and they're walls. The situation in Syria, their borders with countries where, yes, the movement of aid and people is limited, but if you think it's not an occupying force within Idlib, Turkey wasn't. So if you look at the Gaza situation, the occupying force is the IDF on all four corners, even on the corner where there's water, because right off of the coast, there's ships monitoring and shooting at fishermen who are getting close to the critical limit of how far they can fish. There's a gross denial of entry and exit of humanitarian workers and exit of critically ill patients who need care outside of Gaza. You can see on the statistics websites from the United Nations how many patients are being allowed in, how many patients are being allowed out. Going in the first time through the Rafah border, we were able to take a lot of medical supplies, enough that we can perform our operations and patient care. However, this time there were severe restrictions on what we can bring in. We're limited on equipment. Some people are not allowed anything. Medications are not allowed through the Israeli border. And we had to unpack our bags numerous times for various authorities to allow for inspection. The other thing is there's a severe restriction on the movement of people within Gaza. So it's a very small area. And while you're bombarding the north, people cannot move freely to the south. So there's this perception that why don't the people just go to the south? But every single individual is scared to travel from the north to the south because they have to travel through a checkpoint. They don't know who is going to be detained and who is going to be killed. So why would they risk that as opposed to staying where they are and taking the chance of surviving? Now, when we talk about healthcare, and I'll come to a close in a minute. When we come to healthcare, we keep talking about the infrastructure. We keep talking about the hospitals. We keep talking about the physicians. So I developed this very unique understanding this last time I was here, really reflecting on the situation there. And you see that healthcare doesn't just include the building. It doesn't just include the doctors, which you've heard about their detentions and murders. But it also includes the patients, it includes sewage, it includes water, it includes nutrition, it includes transportation and the ability for people to get to the hospital. If you put yourself in the shoes of a patient in the United States who gets injured, say in a car accident, an ambulance picks them up, they travel on a road, they get to the hospital, they're triaged by the appropriate physicians, they're operated on in an appropriate situation, they have adequate nutrition, and antisepsis measures, so they heal, and then they have a rehabilitation phase where they reintegrate into society. Maybe they get their employment back. So every one of these steps is completely and utterly destroyed throughout Gaza. So healthcare involves not just the building and the physicians, but it's a complete and utter destruction of the determinants of health.
Thank you for the really vivid descriptions, Dr. Sayeed. We have a ton of questions. Wanted to respect people's time. I'm not sure we'll be able to get to all of these, but let's get to as many as we can. One that's not quite a question, but Dr. Sayeed, as you're just wrapping up, could you possibly share the recording of the sounds of the drones and the gunfire and the sonic warfare, if that's possible, to share on social media? You don't have to answer. It's just a request if you're able to accommodate. Question to Dr. Sahloul. Thank you for sharing this briefing. Can you give some detail on the damage suffered to Kamal Adwan Hospital during the raid? You mentioned the radiology department, operating rooms, the destruction of certain parts of the hospital. How did this happen? and what other facilities were wrecked that we know about?
I haven't seen Kamal Adwan Hospital, but I know the information from what Dr. Hussam Abu Safiya was providing on a daily basis. He sends daily videos and sometimes audios describing what happened. What we know that over 84 days, the hospital was under siege before it was attacked, and the patients were evacuated to an Indonesian hospital and also to Gaza city. And also the medical staff were detained, initially interrogated in a nearby school, and then some of them were released and some of them were detained. I think 68 or 67 were detained, including Dr. Hussam Abu Safiya. The hospital was either bombed directly or nearby places near the hospital that also caused some damage in the operating room, in the intensive care unit, in the emergency room. Some of the equipment, including oxygen supplies, were damaged. The roof was damaged. Some of the hospital beds, patients' rooms were also damaged in these attacks. And during the last attack, when the IDF went into the hospital, it looks like they destroyed what's left, including in the radiology department, the computer system, some of the incubators and the ventilators. And to me, this is basically attacks not only on certain individuals whom they think, they claim that they suspect of affiliation of terrorism, but the infrastructure that keeps a hospital a hospital. Why would you destroy a radiology department in a hospital? Why would you destroy an ICU? Why would you attack an operating room? Even in the situation of militarization, which is the justification that some warring parties will have to attack hospitals, it does not justify disproportional attack like this that will lead to closure of the hospital, detaining all of the medical staff or displacing them and displacing and evacuating all the patients and making the hospital non-functional for the foreseen future is not justified by any claim.
And on that note, Dr. Sahloul, there's a question which I can't quite locate it, but the question is along the lines of, do we have any knowledge, given how much publicity from the Israeli side there's been about the hospital being used for terrorist activities, about links between Dr. Abu Safiya and terrorist activities? Can you just speak to that point and that question?
This is really a very important question, and I am asked about it, and I'm sure that Dr. Sayeed also was asked about it. We worked in hospitals in Gaza. I worked before this crisis. During the crisis, I worked in Kamal Adwan Hospital before. I worked in Al Shifa Hospital. During this war, in January, I spent 2 weeks between Nasser Hospital in Khan Yunis and also Shuhada al-Aqsa in Deir al-Balah. Other physicians, hundreds of them, who came from the United States, from Europe, also worked in these hospitals. We did not see anything to confirm these claims. I did not see any tunnels. I did not see any sections in the hospitals that are blocked. I did not see any people shooting on the other side from the hospitals. I did not see any people who are suspect in these hospitals. It's like Nasser Hospital is like my hospital in Chicago. You have operating rooms, you have emergency room, you have floors, and every area is accessible to me as a physician who is coming from the United States and to many other physicians who came and worked in these hospitals. So, and I asked Dr. Hussam Blunt multiple times because of these claims, are you in a relationship or affiliated with any terrorist organization? He said no. I asked his family, I asked his wife, I asked his children, and they said no. He only a doctor, a humanitarian who cares about his patient.
Thank you for that. To you, Naji, there's a question here. It's a lengthy question. Essentially, could you tell us more about your contacts, the process that you've going through, your contacts with Israeli authorities, about your pleas for information, Are you in direct contact with the IDF, with Kogat about either Dr. Hussam or the other detainees? Are they telling you anything? Were other members of his team arrested on December 27th? And then contacts with the United States, American authorities, with United Nations authorities. So just a bit about, who do we reach out to? What buttons do we press? And what information do we have from these various angles?
First of all, we submitted to a legal procedure. One, actually, to know the faith of Dr. Abu Safiya.
A little louder if you can, Naji. Sorry.
Okay. Sorry. What I said that PHR submitted, our lawyer submitted two legal procedures. One, to locate Dr. Abu Safiya and to know if he's safe and where he is. Until now, we didn't get any official response, just the response that they published first in the media, actually, the responses to the media before the responses that representative of the family and Dr. Abu Safiya. And they said that he is with the Israeli army. That, as I said, that means nothing actually, because they refused, and till now, they refused to let us know in which facility he is. And they refused and said that he's abandoned from seeing a lawyer till the 10th of January. We have concern that they will make it for longer time. We don't know. We are waiting till Friday. We submitted another legal procedure against the denial of meeting the lawyer. But also regard this procedure, we didn't get anything yet. Till now, we don't have any official information about is Dr. Hussam safe. We don't know where he is being held, under what condition, in what he's being accused. We know nothing actually. The legal procedure till now didn't lead to anything. That's why we work with the international community, with diplomats, with embassies. We are in touch with several, not just the US embassies, regard Dr. Abu Safiya, trying to push the Israeli authorities to reveal if he's safe or not, and to let our lawyer to meet him.
Thank you, Naji. And a related question about the Israeli public. To your knowledge, is this issue being covered in mainstream Israeli media? How is it being covered? And related to that, with the new Israeli cabinet regulations on NGOs affecting registrations, visas, and so on for Israeli NGOs, do you feel that there's a noticeable impact of those regulations on the ability of NGOs to speak out and to advocate around this?
What the first question was? Sorry.
Yeah, just the extent to which this is being covered in Israeli mainstream media,
Okay.
the awareness of the average Israeli person.
Actually, to be honest, unfortunately, everything, and that is very weird when you can read Hebrew and you follow the Israeli media. I can say that most of what's happening in Gaza Strip are not being covered by the Israeli media. There's some newspaper that publish about what's happening, about the war, about the ethnic violations and the genocide in Gaza. You can find some newspaper that speak about the violation of the rights, detainees' rights, but the main media doesn't speak anything. Like in the Israeli television, you won't hear anything about Dr. Abu Safiya, nothing. About the changing the law, till now we can operate. There are a lot of question mark about the tools that we have, the legal system and the authorities or a decision maker. Our work inside Israel and in front of the Israeli authorities are becoming less and less effective. So we are concerned about the changing the law and how they will limit our work. It's sorry to say, we are waiting for that to come, because with the new Israeli government and their policies, and after the start of the war, everything can be possible.
And a quick follow-up, are medical personnel who are detained considered prisoners of war? Can you just clarify that legal aspect?
Yeah, healthcare workers from Gaza, as most of the detainees from Gaza, are defined what the Israeli law call unlawful combats. Unlawful combats is an Israeli definition that replace because the Israeli authorities don't accept the definition for Palestinian as a prisoner of war. So they wrote this law 20 years ago, and all the detainees, including the healthcare workers, are defined unlawful combats. Actually, in the ground, it means nothing. That means that we can say it very surely, that this definition means that they don't have direct clues and accusation against the individual. As I said, in December last year, we found out that 80-year-old woman with Alzheimer was in detention. When we asked to visit her, they responded to us, written response, saying she's an unlawful combat. That can give you a picture how they use this definition. And all of the doctors, most of them, the doctors that we visited, were defined under this law.
Yeah, very clear. Thanks for that answer. Dr. Sayeed, you have your hand up to make a comment, and I'll tack a question on as well. Is it becoming more difficult for foreign doctors to get into Gaza, given your recent experience? What new restrictions are healthcare professionals facing trying to treat patients in Gaza?
So a quick example of, are the people in Israel's understanding what's going on inside of Gaza. An interaction that occurred at the border crossing at the Allenby Bridge on our return was one of a uniformed border officer who was speaking with one of the people who was exiting as part of a humanitarian group. And the interaction went like this. Where were you? And this was a casual interaction. It wasn't an official interaction. Where were you? And the response was that they were at Aqsa Hospital in Deir al-Balah. And the response was shocked. The border guard was shocked. Her response was, are there people still there? So this is one of the most populated areas in the South, and you have an official employee of the Border Patrol asking if there are people still there. So you can imagine, and this is a young person, probably in her 20s, asking this, someone who has access, or what we would assume they have access to social media and an understanding of what's going on. And I've heard from others also, people who are Israeli of a background who really have no understanding of what's going on inside of Gaza. In regards to the restrictions, I had tried to go back to Gaza for a month in September. And I was denied entry by not being placed on the approval list to enter. And I waited on 3 cycles there to enter, and I was never placed on the list, despite being on the World Health Organization list as one of the participants to enter with a mission. There have been numerous denials of humanitarian workers entering if they've been on the media, if they have a social media presence, even if they're reporting on just humanitarian issues and not involving themselves in a political discussion. There's also a restriction on people entering who have any Palestinian heritage. So, and this has been going on for quite a while, where people who can relate to the individuals in Gaza and provide probably better care than many of us are being denied entry. I discussed before, we were able to bring in many medical supplies. This time around, luckily, I was able to bring in some specialty instruments and a very small box of sutures. I brought in a bottle of multivitamins, which I left there because there's no vitamins in Gaza. So, the things that we have access to, which we consider basic necessities, are not available.
Thank you for that, Dr. Sayeed. Again, a ton of questions here. Thanks so much for all your interest. Respecting everybody's time, we'll take a few more questions here. And Dr. Sahloul, I see you, and I'll tack a question on here as well. For either doctor, when you volunteered in these hospitals, did you interact with Hamas? The IDF makes it sound like Hamas is everywhere in these hospitals. Has this been your experience?
So I want to mention something about why we are present as an organization in Kamal Adwan Hospital. Kamal Adwan Hospital is a pediatric hospital. Initially, we supported the intensive care unit. We supported an outpatient clinic also to treat the patients with chronic diseases. And during this crisis, the UNICEF and the World Health Organization asked us to start a stabilization center for the treatment of malnutrition at the site of Kamal Adwan Hospital. So our team was there to provide nutritional support to children who have severe malnutrition. We had 3 clinics, stabilization clinic for malnutrition, one in the north, one in Gaza, one in the south. And our team has treated about 900 children over the past 6 months or so with severe or moderate malnutrition. And these are children who most likely will have irreversible impact of malnutrition on their physical and mental well-being for the rest of their lives. And that's why we had a team in Kamal Adwan Hospital besides Dr. Hussam Abu Safiya. And now all of this is gone. Besides the restriction on humanitarian workers and doctors, there's restriction on humanitarian aid. Despite all of the media attention on, and also the rhetoric of policymakers and international organization about increasing humanitarian aid, I mean food and medicine, to patients or people in Gaza, there is actually a drop or decrease in humanitarian aid to Gaza. Started at one point in July of last year, we had about 250 trucks going into Gaza every day. Before the war, it was about 500 trucks every day. Now it's about 50 trucks every day. So you can imagine the situation where you have people under blockade and war, and all of them displaced, and they need actually more than the 500 before the war. They need about 1,000, 2,000 trucks every day, and there's a drop in the number of the humanitarian aid. And that is translated in basically more malnutrition, more hunger, according to the organizations and according to USAID, our government. 91% of people in Gaza have level 3 or above, the highest is 5, of food insecurity. So people have no access to food, have no access to medicine, have no access to shelter. It's quite cold in the winter in Gaza. I was there and Dr. Sayeed was there. I have not seen any members of Hamas in the hospital. I've seen doctors and patients. I have not seen any soldiers or people who are wearing military fatigue. So all of this talk about Hamas infiltrating hospitals and having headquarters in hospital, I could not verify it. I did not see that. And also the hundreds of doctors from the United States, from the UK, from France, from other places, from other organizations who went there confirmed the same thing, that they did not see Hamas using the hospital as a military points.
Thank you, Dr. Sahloul. Couple more questions here. So this one perhaps for you, Naji, and I also see, I'm not sure if that hand is still up or up again.
Yeah.
Israel's war in Gaza has been the deadliest period for journalists in the region since 1992. According to the committee this is according to the Committee to Protect Journalists. As local media workers tried to report on the horrors while trying to survive bombardment, healthcare workers, including Dr. Hussam, have also become key witnesses. How has Israel's detention of Palestinian medical workers impacted the documentation of this war?
First of all, I want to comment on the claim about
A little louder, please, Naji.
comment on the claim about that the doctors are Hamas or work with Hamas or they are combat. I can give for our audience a very clear example. Dr. Muhammad Abu Salmiya. Dr. Muhammad Abu Salmiya, the director of Al-Shifa Hospital, was arrested in November 2023. If you go back to the Israeli media and what the Israeli military said about his arrest, they described Dr. Abu Salmiya as the biggest terrorist in the world. And that Al-Shifa Hospital is being operated, and Dr. Abu Salmiya is operating the Hamas battlefield directly. But in result, after 7 months, Dr. Abu Salmiya was released. And then if you follow the discussion in the Israeli media, in the Israeli media, they described his release as a mistake. When the Israeli intelligence said they didn't have anything about him, against him. He wasn't accused with and charged with anything, but he was kept in detention for 7 months. We also visited Dr. Khalid Sir from a Nasser hospital, a surgeon, who was arrested in March. In October, he was released. We asked him why you were released, what they told you. He said nothing, I don't know. They came in the morning, said, you come, you are released. So these examples are proofs that these claims, until now, the Israeli military didn't show any evidence about Al-Shifa Hospital after they invaded the hospital twice in November and March. So it's the same case with Dr. Abu Salmiya. So we don't need to repeat the Israeli claims and again and again. We were not in the first month of the war. We are speaking about policies and systematic actions that the Israeli authorities are doing for more than a year now. That's
Thank you,
first of
Naji.
all. That's first of all. For your questions, very fast. We think Dr. Abu Safiya, like Dr. Adnan al-Bursh, who was arrested and killed in detention, these people were a very important witnesses for the systematic and the direct targeting of the medical system in Gaza, and arresting them, and unfortunately, in the case of Dr. Adnan al-Bursh, his death is keeping the truth in the dark.
Thank you for that. Dr. Sahloul, maybe just one or two more here. Since you've been very much in touch with the family of Dr. Hussam, and since we've been unable to reach the doctor, also confirmed by Naji, is it safe to say that he does not yet know about his mother's death?
He doesn't know. It just happened this morning. They were not able to communicate with him. He was not able to send any message, or they did not receive any message from him. His lawyer was not able to see him. They don't know where is he located, although there is claims that he was in this prison in the Naqab desert. Yeah, he's not aware. And his mom is very attached to him. He was very attached to her. She lived with him. She's 74 years old. She's quite functional. She had no medical issues. And I think she just died because of extreme stress and sadness and shock for the detention and the possible torture and verified future of her son, because nothing is now leaking to the family or shared with the family.
Thanks. And since I have you, Dr. Sahloul, with no health facilities remaining for the people in the north, what is happening? What do we know about what is happening to the injured? Do we know where they are? Do we know who's in touch with them? We know that right up to the last moment, there were injured people in Kamal Adwan Hospital. Do we have any details?
I think this is, part of this systemic dehumanization of the Palestinian people. We're not talking about one or two patients. Our media here in the U.S., when we have one person who is, died because of medical mistakes or transportation issues. There is a big talk about this. There is a lot of attention. You have a legal suit. We're talking about tens of thousands of patients who, most of them, we don't know their names, who are denied medical care, who are transported. Some of them die in the road. Some of them die because there is no ventilator, life support. Some of them end up waiting on evacuation list. More than 14,000 patients are waiting on evacuation list. Most of them die before they are evacuated to countries that can provide actually healthcare to them, including the West Bank, or Israel nearby. And they're denied even that right to get medical care in countries that can provide medical care. There are many patients, I know children, a child that was taken care of by our volunteer who had severe burns in Shuhada Al-Aqsa Hospital, and she was on the list to be evacuated to Egypt. And then she was evacuated after 3 months of waiting, and she died 2 days after arrival. So we're hearing about these stories and about the injured who are dying. When every patient I saw in the ICU in Kamal Adwan Hospital was injured, either child or individual who had nothing to do with the war, who was not member of Hamas, and they had complications, multiple complications. And I think Dr. Saeed can verify this. All of them had multiple wounds, infections, and malnutrition because they're not getting enough supplies. And they linger in the intensive care unit on life support, then die because of overwhelming infection, sepsis. And they're not counted as death directly to the war. Every injured patient who end up with operations in the hospitals, in the ICU, eventually they will have complication or die. And I think the international community and people and doctors everywhere should be talking about this issue. This is the humanization of people who should actually, the purpose of healthcare is to save lives. Yes, you are doing operations to control the bleeding and maybe stitch and remove the bullets and the shrapnels, but then these patients eventually will have complications, lifelong disability. Many of them die because of multi-drug resistant bacterial infection and sepsis, and or malnutrition and related to complication malnutrition. No one know about them. So that's the plight of the injured, Joe. And we're talking about 6% of the people of Gaza who are either killed or injured. 6%. And you can extrapolate the number of people in the United States if 6% are killed and injured. More than 80% of the injured have moderate to severe injury. That means they will have lifelong complications or disability or amputation or infections.
Thank you for that answer. Let's make this the last one. For you, perhaps, Naji, Dr. Sahloul was just speaking to how every doctor must be feeling this, how every doctor should be speaking about this. The question is, have you seen a sort of code of silence among healthcare workers in Israel? Is there a widespread fear of repercussions if they speak out about concerns over Gaza's health crisis?
Let's say it's different from in the general picture. The Israeli physicians and doctors are not different from the Israeli public. First of all, they don't know. A lot of them don't care, and some of them, unfortunately, don't have problems with everything happening in Gaza. We saw that when a few doctors in one of the Israeli hospitals demanded that the Israeli army invade Al-Shifa hospital last year. We see that when the Minister of Health in the beginning of the war called not to hospitalize any Palestinian detainees, that the Ministry of Health and the Director of Hospitals approved and actually worked like that. In some cases, patient detainees who the Israeli army saw that they need to be hospitalized, they arrived to the door of the hospital and the hospital refused to accept them. We collected testimonies from and on the other hand, there is the PHR have volunteers, Palestinian and Israelis. Some of these volunteers were the main whistleblowers about what happens in Detainees because in somehow they entered this facility. So they revealed what's happening in Detainees. Some of the doctors, also Palestinian but also Israeli, gave us testimonies about the violation of the right of health, not in the detention facilities, inside the civilian Israeli hospitals. When a doctor speaking proudly how he didn't give painkillers for an injured patient. So you can find this and you can find this, but in the general picture, the Israeli health system is no different from the whole system in Israel, the whole system, the whole public opinion in Israel, that they don't care and they are not speaking out. We are asking and demanding the Israeli Medical Association to speak up out against the violation that happened in Sde Iman. Sde Iman, the hospital, the field hospital in Sde Iman, was operated by the Ministry of Health, not by the army. But the Medical Association in Israel defended the violation in this facility. They said that it's okay that people are getting treatment when they are cuffed and their eyes are covered. This is the Medical Association. The Medical Association refused to speak out about the violation and the information that we provide them in what's happening in the hospitals or in what's happening in the clinics of the Israeli prisons. Till now, the IMA, the Israeli Medical Association, are not speaking anything about this violation, and in some cases defended it.
Yes. Now, thank you for that description of the systemic complicity here. With that, we will bring this session to a close. Thanks so much there was quite a few comments that I couldn't quite get to read out, really, and some of them really supportive and encouraging. Really appreciate that. And again, apologies that we couldn't get to all of the questions that you posed, but please feel very free to reach out to Logan or any of us to follow up if you have further questions or want to go further with this. And thank you to Dr. Sahloul, thank you to Dr. Sayeed, who had to hop off to go and treat patients, and to Naji as well. Dr. Sahloul, you want to? Yeah.
I suggest that these questions shared with us, and we will be happy to respond in writing to reporters.
Yeah, great. Sure thing. Logan, can you help with that, please? And with that,
yes,
thanks so
Joe,
much, everybody.
If you just hold off 1 second, I'm just putting into the chat for everyone the email. medglobal@westendstrategy.com, and we'll make sure that your questions are forwarded on to the speakers. Or if you're already in contact with someone from our team, of course, please feel free to send the question their way.
Excellent. Okay, thank you, Logan. So that email address is in the chat now for everybody.
I just wanted to say that BHR will keep updating in everything that we managed to know about Dr. Hussam, get further information or manage to visit him in the next few days. That's what we hope.
Thank you.
Thank you, everybody.
Thank you.